Hi, everybody. This is Dr. Joel Singer again. As you remember, I'm a retired board-certified plastic surgeon with over 50 years clinical experience, and I'd like to discuss my own thoughts about how I stayed healthy, prevented aging, and looked so good at the age of 81. So it's based on my study of research and science, and that's what I'm going to present to you. So mostly, we talked about last time, we talked about diet, exercise, and rest, and how that actually impacts the healing capacity of your body, which is in your stem cells. So we're going to look at that again from a different point of view. So there's a lot of scientific evidence that stem cells help healing and prevent disease. So let's look at a couple of examples. Now, as you know, cardiovascular disease and heart disease represent the most significant disease that we die from in the United States and the rest of the Western world. It also represents a significant amount of disability. So what causes heart disease? Is it high cholesterol? Is it lack of exercise? Is it stress? We don't really know all the answers, but I'll tell you one thing. One of the things that we really should be looking at is the role of inflammation in cardiovascular disease and heart disease. So this is a paper that I pulled out of the literature where they used stem cells to treat various arteriosclerosis disease and what the implications are of this particular study. It's a small study. It gave people autologous mesenchymal stem cells and then measured various measurements throughout the body. And it turns out that if you measured HDL, LDL, total cholesterol, and various other parameters that represent markers of heart disease, these all get better if you give mesenchymal stem cells. So this is an interesting study. And I think what it points to is that more studying has to be done. In fact, here's an example of where the thickness of the lining of an artery actually decreased, giving more blood flow in a patient who had mesenchymal stem cells. So does this prove anything? Not yet, because you have to do a more extensive double-blind study. But in later videos, I'm going to go into more detail about some of these studies that are double-blind, that have been randomized, and do show evidence that cardiovascular disease is treatable with either autologous or non-autologous stem cells. Now, when it comes to lungs, we know there's a great amount of surface area, and lungs are responsible for keeping us alive. You have to breathe in air, extract the oxygen. We need our lungs. So when our lungs get into trouble, we can get very sick. So it turns out that the recent COVID epidemic, especially the early disease states, produced a reaction called ARDS in the lungs and actually caused damage to the inner lining of the lungs, and people died from this reaction. They didn't die from the virus per se. They died from the immune response to the virus. And this is serious. So anyway, this is a study where they used mesenchymal stem cells to see if it would improve the outcome of COVID-type pneumonia. And, sure enough, in this particular case, it seems that the lungs pacified here and then cleared after intravenous treatment with mesenchymal stem cells. So there's a lot of room for more research as far as lung and as far as the reaction to COVID using stem cells. There's a lot of literature, his references. I'll put this down below so you can read it yourself. What about diabetes? What about sugar metabolism? What about glycemic control? Diabetes is one of the leading causes of disability and death in the world today. And what is it caused by? It's caused by lack of glycemic control. And so anyway, is there a role for stem cells in this? Yeah. Here's one study patients with type 2 diabetes were given mesenchymal stem cells, adipose-derived mesenchymal cells, and they were studied. And it turned out that it improved glucose metabolism by allowing the insulin to actually work better. It reduced the inflammatory response, especially in the fatty tissue, which is responsible for insulin resistance in some respects. So this particular article leads us to believe that there is plenty of room for more research in this area because, listen, diabetes is serious stuff. So if we can treat this using our own stem cells, this is wonderful. So, in fact, I just want to indicate something. Personally, I have a tendency toward diabetes. It runs in my family. I have a slightly elevated hemoglobin A1C, right? So I've had intravenous stem cells. Okay, I've had these treatments myself, and my hemoglobin A1C has improved to now it's within normal range, a little high, but within normal range. So I'm convinced that the stem cells have helped my glucose metabolism, and I don't have diabetes. Interesting additional study, had nothing to do with what I just said, but alcoholism, inflammatory process in the brain. And this is just in laboratory rats made alcoholic and then given stem cells. And the results were pretty astounding. The alcoholic rats were no longer alcoholic. Lots of room for more study in this area. So again, none of these treatments are FDA approved. I'm not advocating any treatments like this, but I know personally from my own experience and from the research I've done that these are legitimate areas of research that must be continued and should be continued, especially in patients. So for more information, you can look down below. I have references. If you like what I've just said, please click the like button and subscribe to my channel because I have a lot more of this stuff coming down the pike. So you'll be listening more and more and enjoying this very much. Thank you so much for listening.